Good morning, everyone, and thank you for joining us for this webinar, part of the Kentucky Creative Industry Summit series that is being brought to you virtually this year for the purposes of safety and health as we continue to live through a global pandemic. Before we begin the program, I'm going to offer a land acknowledgement. A land acknowledgement recognizes the unique and enduring relationship that exists between Indigenous and Native people and their traditional territories. Today, we are on the grounds occupied by ancient peoples whose history has been lost, but whose legacy remains. We are close to the mounds in Ashland and the Lower Shawnee ceremonial grounds in Greenup County. The earliest inhabitants have been referred to as the mound builders of the Adena, Hopewell, and Fort Ancient time periods. The Shawnee were the most recent inhabitants and were in Kentucky just prior to the 1960s. They shared Kentucky with the Cherokee in the southeast, the Yuchi in the south central, and the Chickasaw in the extreme western part of the state. The evidence of these ancient people can be seen all over Kentucky through the mounds and artifacts left behind. Today, over 170 American Indian tribes are represented by their members living and working in the Commonwealth. Let us remember and honor those who were here and those who are here, remembering the vast array of gifts that they left us. Let us honor their presence, both past and present, as we strive to take care of this beautiful land and build on the legacy of stewardship they left for us. Thank you. My name is Emily Moses, and I am the Executive Staff Advisor for the Kentucky Arts Council and producer of the Kentucky Creative Industry Summit Series. Our webinar today comes through a partnership that we're very grateful for with the Emily Hall Tremaine Foundation. We're grateful for their generosity and their continued support of our work. In the early days of the COVID-19 pandemic, Shoreline Arts Alliance, located in Guilford, Connecticut, recognized the statewide need for science-based knowledge and information for arts venues, organizations, artists, and those creating regulatory protocols in Connecticut. Shoreline Arts Alliance called upon the Yale School of Public Health and partnered with them to explore and deliver science-based information to inspire both artist and consumer confidence and ensure economic success and long-term viability. We are thrilled, let me say it again, thrilled that Shoreline and Yale School of Public Health have made time available to talk with Kentucky arts organizations today. I am now going to turn our program over to the CEO of Shoreline Arts Alliance, Eric Dillner.
Thank you so much, Emily. Well, we're thrilled to be here and to be invited and for the support of the Tremaine Foundation to get us here today. So thank you so much. We're once again welcome to Reopening Connecticut Arts Venues, Science-Based Safety, but in Connecticut, in Kentucky today. There we go, I got it. In Kentucky today. Again, I'm Eric Dillner. I'm the CEO of the Shoreline Arts Alliance and the chair of this task force. And we just are thrilled that you want us to share a bit of our project and hope to support you and your fine work throughout your great state. Again, thank you so much for having us. The mission of our task force is to offer you the opportunity to reopen your arts venue from a public health perspective, provide a listening and sharing platform, and help build consumer confidence through science. Our goal is to offer clarity, practical scientific advice, and an opportunity to ask questions related to your own risk reduction strategies, to help you dive deeper into your own process on when and how to open or how to stay open in these times, leading to consumer confidence for all your staff, your folks who are coming into your venues, and ensuring success and a long-term viability for the arts sector going forward. We know that together we can and will reopen arts venues with prudence and knowledge. To date, our webinars have reached over 9,800 viewers in over 15 states and 4 countries. We've been working with groups like the U.S. Coast Guard Band, various symphonies, arts collectives, playhouses, ballet companies, historical museums, dance centers, schools, performing arts centers, outdoor venues as well, and individual artists in pursuit to reopen through the lens of science. I encourage you to visit Shoreline Arts Alliance's YouTube channel, and Facebook to get a lot of additional information. And our website has it all bottled together, which is www.shorelinearts.org. So, and then of course, feel free to share that broadly. We're just here to help and want to get the word out. I'm thrilled to introduce to you the doctors who are here to help you reopen your arts venues and keep us safe. I'm pleased to introduce my co-chair, Sten Vermund. Sten is the Dean of the Yale School of Public Health and holds the Anna M.R. Lauder Chair in Public Health, as well as a secondary appointment in pediatrics at the Yale School of Medicine. As an infectious disease epidemiologist, Sten's research pivoted quickly to focus on the COVID-19 emergency. Now, what's really fortunate is that Sten and his wife are so deeply fond of the cultural arts, and that just adds to this whole thing that he truly loves art and spends a great deal of time with he and his wife out in the museums and in the plays and shows. So we have a great perspective coming from him. And with Sten today is his colleague, Krystal Pollitt. Krystal is an assistant professor in the Department of Environmental Health Sciences in the Yale School of Public Health. And she holds an appointment in the School of Engineering and Applied Science. Her research is focused on understanding our exposure to environmental factors and the impact on health. What's fantastic is Krystal's particularly interested in chemical and biological exposures in indoor spaces. So needless to say, we're in great hands. Again, thank you, Emily, for inviting us here to Kentucky to aid in your process to reopen arts venues. I'm thrilled that we will have several questions coming in from some of your leaders in the community, but feel free to use the Q&A to send in questions all the way along. We'd love to get to as many answers for you as possible. So Sten, without any further ado, how about we get started by answering that big, broad question: how do we reopen arts venues from the public health perspective? Sten?
Yes, thank you. We have a lot of challenges in reopening the arts, as the group on the call knows today. First of all, you have to know something about the epidemiologic context in your state, in your area of the state, and you need to be sensitive to the local dynamics. We have tremendous variability in time and place. For example, Connecticut a month ago was one of the safest places in the country for COVID, but in April it was one of the most dangerous places. So one looks at the arts very differently, say in the month of April in Connecticut versus the month of September. I think we appreciate that when we open the arts, we need to attend to our 5 core public health interventions that are available to us. One is masking, so that we can avoid the gratuitous spread of droplets and aerosols. The second is physical distancing, which is designed to avoid proximate spread. And by the way, the 6-foot distancing is not arbitrary. It's based on a lot of science related to outbreaks in closed spaces like restaurants or airplanes or trains, even laboratory experimentation. The hand hygiene and surface hygiene strategies, the maintenance of outdoor air when possible, and when it's too cold or too hot, maximizing the quality of indoor, and my colleague Professor Pollitt will be talking about that. And then smaller group gatherings, rather than a very crowded sort of football stadium or political rally type gatherings, smaller gatherings, more thoughtful, so they can be physically distanced. Now, this creates immense challenges in the arts, because not every arts venue can make a living being only 40% full. On the other hand, there are arts organizations that can pivot to outdoor events, that can pivot to Zoom events, that can manage to break even if they have lower cost events planned, and they can fill 40%, 50% of their venue. So these are the sorts of things that I think we'll be talking about today, and we'll be very eager to get all your questions in, and I'm glad we have some prior questions. By the way, I am with you live, and now they're letting me turn on my video. There I am. By the way, I want to gain a little legitimacy for Yale and Kentucky. So in the chat, I've put a little bridge of how the president of our university is very closely tied to your state. And before I came to Yale in 2017, I spent 12 years on the faculty of Vanderbilt University and got to know Kentucky well as a tourist, transferring Tennessee money to Kentucky museums and arts events.
Well, thank you, Sten. Thanks for getting us all on the same page. And it's a very small world. We're all obviously in this together. So thank you. I'm thrilled that we have Kim Baker from the Kentucky Performing Arts Center, who'd like to get our focus towards staff and volunteer safety. Kim, you have a question for us?
Well, I think that the question that I was presented with was, are there special circumstances we should consider for our staff and our volunteers? And just to comment on that, I'd love to hear kind of what you think about that from your experience.
Thank you.
Well, those of us who are my age and a bit younger grew up on the live arts. We were before the cable television revolution. We were before the advent of video games. I was even before air conditioning. I remember my ice box as a kid. I would cool my hands on the ice in the ice box, and the only air conditioning in my home was in my parents' bedroom, a little air conditioner in the window. So the reality is we were outdoors, we were at music events, we were at museums, and so there does tend to skew towards the older age folks who are fully embracing the arts, with the exception perhaps of pop music and country music. But many of our traditional arts, such as opera, ballet, symphony orchestras, museums, are often frequented by and staffed by older persons. So you're absolutely right to bring this up. We do need to be cautious with our docents and our tour guides, our volunteers, our ushers, and our employees. We are keen to keep people out of harm's way, and the same big five that I just mentioned, maximizing air quality in your venue, keeping groups small, the ready availability of hand sanitizer, the ready availability and universal use of masks, and physical distancing. So when we've been going through museums, for example, it's generally quite possible to create one-way directionality and to have markers of every 6 feet so that you can remind people to keep their distance. You can allow people to enter your museum only if they have a mask. You can have prearranged sort of census limits on the museum, just allow a certain safe number of people in. Similarly, with drama, arts, and the like venues, you can create seating arrangements so that cluster families that are not physically separating from each other at home. So you might have 5 people sitting together, but then 6 feet away you might have a couple, and 6 feet away from that you have a group of 3. And 6 feet away from that, you have a group of 1. So then you are able to populate your theater or your arts venue to the maximum number but still maintain that physical distancing, asking the folks in the audience to wear masks throughout the performance. There are many other areas in which we can help protect the performers themselves, but these are some of the strategies. Now, if a volunteer is at higher risk because of age or obesity or underlying medical condition, then they need to be extremely well informed, and you may need to consult with your attorneys as to signing of a waiver so that they understand that they're taking on some of this risk themselves. But you then are obligated to do everything you can to protect them. We have had good success in a number of our arts venues in Connecticut with reopening, thinking strategically about giving people options for volunteering and not actually being on site. For example, the notion of being a museum docent through WhatsApp or through some sort of video connection in the museum, so that one could literally go along with a group of visitors, but not be present. And that would be a docent who has taken photographs of the art or whatever they're showing, and would be in a position to discuss it even though they were in absentia. So there are many different strategic approaches. One can even shuffle responsibilities by giving sort of forward-facing jobs that are, box office or facing the general public to less vulnerable individuals, and pivoting the more vulnerable individuals to other tasks that are not as forward-facing. I also recommend trying to substantially diminish crowding. So you may have different strategies for coming into a lobby. You may have a strategy for prior purchase so that there's no need for box office activity or minimal box office activity. And one has to reconsider concession stands, and one may enable online or ordering by seat, and one could actually deliver products to the person seated rather than have the crowding around the traditional concession stand. That may require a sort of all hands on deck approach to the intermissions or before the performance, since one would have a big job in delivering those items, or closing concessions if it's not a vital part of your income. Now, we could go on and on. There are many other examples where we're going to try to keep people safe, but let's move on to the next question.
Thank you very much.
Thank you, Sten. Steve Hoffman from the Norton Center of the Arts has a question for you.
Yeah, hi Sten. You just mentioned performers and touched on front of house staff. How can theaters keep their performers and production staff safe during the preparation and performance process?
Great question, and I thought we'd get there fast. Something that is being considered by many arts organizations is kind of sad for the performers, but that is to do Waiting for Godot instead of Les Mis. Do a program with 4 actors rather than 40. And a lot of arts organizations have been forced into this for financial reasons. They simply can't afford to put on a show as costly as they had intended in the pre-COVID era. And that also facilitates physical distancing on a stage if one has a smaller ensemble that is interacting. There are ideas out there that I can share. You can try to forego intimacy. Now, I admit that we're performing Romeo and Juliet without the kiss or the clutch would be an immense challenge. But one can try to physically distance performers as best one can. I've even heard of one director who took a classic play, pivoted it to the modern era, and had it within the COVID context, and had all the performers wearing masks, because as the drama was pivoted to being nested within the COVID era, then it made sense to the audience. One can also maintain safety around musical instruments and singing. But since Professor Pollitt has been consulting with the Yale School of Music for the better part of 5 months now, and has actually been working with them very intimately on all those issues, I'm going to turn it over to her in just a moment to comment on singing, musical instruments, this sort of thing. Keep in mind that when we can do things outdoors, we prefer to do that. If we can keep the performers 18 feet distance from an audience, then they can do things that they can't if they're only 6 foot distance, because 6 foot distancing counts when you're having normal conversation. But if I'm an opera singer like Eric Dillner is, I've learned how to project. And that means that my droplets and aerosols are going to go a lot further than 6 feet. Similarly, you know, if I'm playing a Mahler symphony and it's time for me to play loudly on my trumpet, I'm going to be projecting aerosols. So Krystal will tell us some of the strategies a little bit later on that issue. Keep in mind too that we are used to a pretty crowded backstage, a pretty crowded green room, and we have to consider our stagehands, our makeup artists, our sound experts, our lighting specialists, even our music librarians, our volunteers, and we have to orchestrate things differently. We have to think about it differently. We have to think about our green room differently. And to be honest, we've done a number of walkthroughs, and I've seen people with straightforward advice, like the advice we're giving today, some of the written materials that are available by various arts organizations, and they've done a marvelous job pivoting their backstage and trying to maximize safety, not the least of which is the distancing, the ready access to hand hygiene, and the universal mask use. But I'll defer to Krystal in a moment when she'd like to comment about instruments and singing. By the way, one last comment about drama and dance. I've seen some very creative approaches to sort of considering dancers almost like a flock of birds, where you do the orchestration in such a way that the choreography is keeping them apart even as they do dramatic moments. And I've seen folks in classrooms set up sort of boxes where the children, or less often the adults, are in a box and they dance within their box, which helps them be physically distanced. And if they do movement choreography, they do that either within the box or they do it in a very carefully orchestrated box to box to box sort of flock of birds movement. So, you know, in this time of need, all of you can apply your creativity as artists and managers to thinking through how we can keep our performers safe and our students.
Great, thank you, Sten. Before we get to Krystal here in a minute and talk about more of those engineering controls and things, let's go to Mitzi Simmet, All Here Together Productions, and ask her a question about audiences.
Hey, good morning. Stan, you've spoken mostly and identified all the things that I was thinking about when looking at audiences. I also really appreciate the diminishing crowding. I hadn't heard that term, and it's a good way to click in and remind our families about that. The only addition, what about when we're talking about what does an audience look like? Because you've identified the 5. And spacing, and you painted a clear picture of that. What about, is it worth taking temperatures of audiences coming in? Like, is that an addition, or is that something we can really count on knowing that?
Temperature taking has been highlighted by many arts venues, also schools, some businesses, etc. On principle, I've got nothing against knowing more information about somebody. And in principle, I suppose one could do that. However, you beware of what you wish for. It's very easy to have a temperature slightly elevated. Let's say that it's November, I'm a little cold, I put on a warm coat I get into my car and I drive to my arts venue. I drive to my museum or my performance or whatever it might be, my lesson. When I get out of the car and I've been in the car and I put the heater on, I may be overheated and I may have a very low grade temperature, and I'm perfectly healthy and perfectly normal. And the next thing you know, the arts venue trying to do the right thing turns me away from the door. And all I've done is I've cooked myself a little bit with my coat and my warm trip to the arts venue. So you're going to have a lot of what we call in the field of epidemiology false positives. You're going to identify a bunch of people with very low grade fevers who are perfectly healthy. So we also have a wide variety of quality of these temperature gauges. Some of them are more reliable than others. And there is a logistic challenge that to take the temperature of every, it's hard enough to take everybody's ticket. Now you've got to take everybody's temperature. And if possible, you'd love to do sort of ticketing without anybody, put a barcode in a scanner, and if it lights up green, then they can go through. You're not going to be able to quite manage that with a temperature. And you really want somebody greeting all of your subjects in full body armor, the PPE, personal protective equipment, taking temperatures as they come in when we're not absolutely sure it's going to do much good. In some ways, you could say taking temperature is redundant to the big five. The big five being the physical distancing, the masking, the hand hygiene, the smaller groups, and the air quality. Because if you've got those big five, even if somebody has a little temperature, they've got an incipient viral syndrome of one sort or another, could be 10 different things other than coronavirus, you're still keeping your audience safe. That's why I'm not a wild fan of temperature taking, but I'd be happy to hear Krystal's viewpoint.
Great. Thank you so much, Mitzi and Sten, for that. So let's get to the air controls. Todd Birdsong from Clemens Fine Arts Center. Would you like to ask a question here?
Sure, yes. Hi, Sten. Thank you and Krystal for both being here with us today. So you've talked about air quality earlier. You kind of touched on my question, which is, as an arts facilities director, what are some ways that I can control the quality of the air that's going to benefit the staff and the artists and the patrons that are going to be watching the show?
That's a great question. So as was mentioned before, there's aerosols that are being expelled through a lot of different respiratory activities, from coughing, as we're well aware, but also when we're singing or projecting, there's a potential for aerosols really to disperse and travel quite far. But even breathing and talking are also going to release aerosols. So thinking about that indoor air quality is so important, especially now. And it really, to address indoor air quality, it's key to understand the ventilation within your space. And the challenge in this now with COVID is that every space is so different in terms of how it is ventilated. And the two basic distinctions that we can make and defining points in how we manage air quality is, does your building have mechanical ventilation? So is there an HVAC system for centralized heating and cooling? And if those buildings have HVAC systems, we really want to leverage these centralized systems and use them to our advantage to be able to bring in outdoor air into our space, so this outdoor air won't have concentrated amounts of viral material, and also use it as a central filtration system. So making sure that we have high efficiency filters that are installed within the HVAC systems. We've been recommending use of filters that have a MERV 13 or higher rating. So these will offer a filtration of, on average, 80% of aerosols that may contain viral material that's removed every time that air is recirculated within that space. And so similarly, we want to introduce maximum amounts of outdoor air that doesn't have to be recirculated. So being able to maximize this open up damper settings within HVAC systems is really ideal within while we're dealing with COVID precautions. So similarly, we're thinking about airflows within all of these spaces that our HVAC system can offer. So how can we maximize the amount of times that air is changed within every space where we'll have occupants? And we're aiming for air changes on order of 5 to 6 times an hour to maximize safety. So what happens for spaces that don't have HVAC systems? Because this happens in many cases with older buildings that don't have these centralized units. And there's many, many options that are also available in these cases. And here we can look at some low cost and even no cost solutions. Opening a window is a fantastic, elegant approach that has been shown to offer ventilation. Depending on the amounts of air movement, the wind speeds, that's a really good solution. So working in a space that has windows, leveraging this. Also the option of increasing ventilation by use of a simple $20 box fan. So by putting a box fan in a window, you can now create a negative pressure space where you're exhausting indoor air, where you have your occupants, maybe potentially asymptomatic infected, releasing aerosols, droplets, that you can now exhaust more efficiently into the outdoor space. So those are two really great surrogate methods that can be used. And the final one that I'll suggest, and we'll also perhaps talk about a little bit more, are portable air cleaners. So just offering that you can put right into a space, potentially right beside an individual, releasing a large amount of aerosols that could be of concern.
Krystal,
So
you
actually,
broke up just when you were talking about the air purifiers. So just repeat that sentence.
Oh, okay. I apologize for that. So these portable air purifiers, and I apologize, my internet's also saying that it's unstable. So can also offer supplemental filtration that you can put beside someone that might be infected or asymptomatic.
so Krystal, I just shared the screen so that you can take us through a couple of these.
Okay, perfect. So this is a fantastic lead into an extension on that. So what we've been thinking about a lot is these types of portable air purifiers. And I'm sure many of you are aware of commercially available air cleaners that you can purchase from your local hardware store or online that are equipped with a HEPA filter. So these HEPA filters offer 99.97% filtration of aerosol material release. So incredibly efficient, and they can be utilized within a great number of spaces. Now, one caveat with these devices is that they can be fairly expensive. So we're talking about devices that might be $300 to $600. And as you start scaling up for the number of indoor spaces you have, especially with colder weather approaching, we were thinking about what are low cost options in which we could recreate similar types of efficiency that now are only going to cost you maybe under $50 to produce yourself. And so the way that we're doing this is we're taking a box fan purchased from any hardware store, so a 20-inch by 20-inch box fan, and strapping a furnace filter that you can get at the same hardware store right onto the front of it. So we make sure that there are no seals, because air will always take the path of least resistance. We want to force that air through the filter. Now these filters, these fans offer incredible amounts of airflow, moving 1,000, 2,000 cubic feet per minute through. So incredibly efficient as a filtration tool. We also have another design for larger spaces that it can offer even more airflow. So Eric, if you just click to the next slide, and this is where we create a box, so a cube of filters that allows for more airflow through the fan, and this can be placed into a larger size space where you might have more occupants present. And here's an example of the constructed units. This is one that I built. I placed onto a small school utility cart so you can wheel it around to different spaces to really maximize use depending on where occupants are.
Great, thank you so much. That's so helpful with the low cost area use of these types of DIY products. Thank you for offering those. Now, Sten, we covered this a little bit earlier, but I'd love to offer Mitzi Sinnott one more opportunity to focus in on dance studios. I know she had, in late August, they opened their studio. Mitzi, would you like to share a little bit more about that?
Sure. And I love this idea of what you've just now shared, because I've been thinking that we have 4 large dance rooms and I've been trying to get my mom to open the windows more often and things like that.
Yeah.
But are there any other things, like we have the kids, wipe off the bars before and after, and the windows open, but have you heard of any other kinds of things? I like, Sten, you also said the box that dancers use. We use that in class. We have X's on the floor. I'm just thinking about being in that room with 10 kids. Our state of Ohio and Southern Kentucky says you can't have more than 10 kids in a room. Just any other thoughts about safety in a dance room?
Well, Mitzi, you just mentioned it yourself. The kids themselves can take, and the dancers themselves can take some ownership. And if dancers are anything, they are disciplined. So the notion of wiping off bars after use, maintaining the physical distancing, maintaining the mask use. We don't have an outbreak in a dance studio to date, and I hope we never will have one. Now, keep in mind that everything that Professor Pollitt has been highlighting applies very nicely to a dance studio, maximizing the quality of air. If it's a pleasant day outside and you have a box fan and you can point it directed outside, you can create negative pressure by sucking air out of the dance studio out into the outdoors. Just close off the rest of the window or door that you're using for that. You can have these low-cost filter box fans for when the weather is inclement or cold, that Dr. Pollitt's designed, and she just showed you a picture of what one of those looks like, and she can drop a convenient website into the chat for you for you to have. It's under our school COVID section of our website, but it equally applies to the arts. And maximizing, if you have an HVAC, heating, ventilation, air conditioning, if you have such a system, what's sometimes called central air, then you can work with your contractor to tweak that, have it include more outside air, have a MERV 13 filter installed rather than the typical MERV 8s or 7s that are often in place. That'll be a tighter weave, and perhaps up to 5 to 6 air exchanges per hour. And if you don't have a central HVAC, or your HVAC company says, no, there's an old machine, we can't do all the things you're asking, then some of these other strategies for air purifier. Now, you can also spend $300,000, $400,000, $600,000 on a commercial air purifier, and those work fine. They tend to be a little quieter than a box fan, but the $70 box fan MERV 13 filter combination, just make sure you put the filter on the back of the box fan so it's sucking air through the filter and blowing it out. Yeah, exactly. There it is. With a little epoxy and duct tape, $70, and you've got an amazing air purifier system that Dr. Pollitt's designed. It's just extraordinary how efficient such a simple device is.
Sten, along the same line, we have a question that just came in the Q&A that's asked about sanitizing surfaces. This looks like it's more for an art museum, but it's all along the same line. In stair railings, door handles, countertops, how often should this occur? This specific question is,
yeah, there's no right answer to this.
Okay.
Because in theory, we want to follow every visitor around, and as they touch something, we want to wipe it off right after them. That sounds like the precept of a comedy skit on Saturday Night Live, but we can't do that. So what institutions have done is they've set up a sort of standard practice where they will do handrails, door knobs and door handles, and maybe the push of a door, and they'll do that on some reasonable, regular basis more than they usually do? And is that every half hour? Can your custodial staff or your volunteers manage that every half hour? Can they manage every 20 minutes? But I don't think we have a convenient solution for that. Now, if your fire marshal will permit you, you can sometimes keep a door ajar or open with a door stop that you typically would keep closed. So there's no need to touch the handle, and there's no need to clean it regularly because nobody's touching it because you don't have to use that. So there are those strategies as well.
Thank you. That's very helpful. When we were at one of our performing arts facilities, we discussed how we could separate our artist from the teacher, and we're talking a little bit in the teacher world. And this was a good example of what we found is the great use of a lobby to maybe teach that lesson that may have been in a smaller studio at some point. So that's Sten in the background here, and we were just thinking about that. But let's skip over to wind instruments and dig a little deeper about performing artists and what we can do to help. Krystal, well, actually, let's see, we have a great question here from Kim Baker again. If you could help me with that question, that'd be super.
Yeah, thank you. We have our Louisville Orchestra here in Louisville, and a space that is new called Old Forester's Paris Town Hall, and it's an open space with lots of flexibility, and we've been really collaborating with the orchestra from a facility side. They're of course from the orchestral side, making sure the musicians are safe. They've got some wonderful protocols in place, and I'm curious as to what you would recommend as far as the spacing and the distancing between instrumentalists and how you're seeing that for both inside and outside, the best and the safest way to place your brass and your winds and your percussionist and all the different types of instruments.
So I can start with this one, and then we can elaborate further. So with all of these brass wind instruments, there's been a number of research studies that have started to look at what are aerosol emission rates from the different type of instruments. And perhaps Eric can bring up a slide that was taken from a recent preprint publication from the University of Minnesota that compares different instrument types to give an indication for levels of risk. So this was a really beautiful figure that was prepared from one of these studies, where they compared different instrument types compared to the amount of aerosol release from just breathing or speaking. So to orient you, the different types of instruments shown here, the green colored band represents the amount of aerosol or particles that are released from breathing. The red is speaking, and then you can show the relative levels coming from different instrument types. So here, very clearly, it highlights instruments like the clarinet, the trombone, oboe, and trumpet, increased risk. So those are really the ones that particular attention should be paid to in terms of applying risk mitigation measures like a bell cover, potentially fitted also with a filter, and increased spacing from other musicians around. So Eric just briefly went on to the slide showing these examples of bell covers that have been tested and shown to be fairly effective at mitigating aerosol release. So this is just simply a fabric cover that's placed on the bell. They can also be lined with a filter material. So again, these can be a MERV 13 filter material, commercially available, can be purchased, cut out to fit around the bell, and then just placed over that bell. Again, there's masks that can also be worn by musicians as well that have slotted inlets. I really like the ones that have a cover and overlay so that there's no gaping hole once the instrument is released, removed.
Great. And do you want to share a little bit about this slide that we brought in here, Krystal, and why we have this?
Sure, of course. So during the summer, Sten and I, together with a really fantastic group of PhD students and other collaborators from the Yale School of Public Health, we wrote a chapter focused on reopening schools safely. And we went through different rooms within schools that could be a potential concern and ways that we could apply different types of engineering and also administrative controls to promote a safer reopening and a safer building environment for students and staff. Music rooms are one that we highlighted here. So I just show this as an example of different types of disease control measures that can be applied. All of this is listed on the website that I placed into the chat. So I encourage you to review this at your leisure. And I'd be happy to answer any of the questions that come up after this webinar as well.
Excellent. Thank you. We have Joy Brown from the Rowan County Arts Center, who has a question she'd like to ask about studios and musicians.
Yes, do shields help in the studio and in between the musicians?
That's a really great question. And we've seen that popping up a lot in different types of spaces. So we think about the effectiveness of shields. We can think about their effectiveness in relation to different routes of transmission, modes of transmission. So we know that close proximity to an individual, that's going to place you at risk, especially if there's prolonged content, because there's these ballistic droplets that are released. And they'll be projected from an individual depending on if they're speaking or singing or playing an instrument. And the shields are great at impacting those droplets. But thinking about other modes of transmission with aerosols, they're really not going to do anything at all. So these aerosols are incredibly small. They're great at dispersing and navigating their way around shields. So it might present a false sense of security by having them present. So it's important not to rely on those as simply the only means for risk mitigation. And here listed on the slide are other questions to be asking about a space if there's only evidence of a potential barrier being placed within the room.
Great. Sten, do you have anything you want to add to that? I know that's been one of our interesting subjects, hasn't it?
No, just a strategy. If you're a voice teacher, piano teacher, any woodwind, brass, you know, we are thinking about that physical distancing, and we all know that that's kind of artificial because, you know, the clarinet teacher is showing the fingering and the piano teacher is showing the fingering and the strategy, but if we can have, you know, the teacher distanced, and then they can come to the student periodically and show them something, and then they can retreat, if you will, hand hygiene. It's a bit of an in and out kind of approach, because if you keep in mind that the Centers for Disease Control and Prevention, the CDC in Atlanta, has a definition of a contact, and that is less than 6 foot distancing for more than 15 minutes. And your likelihood of encountering the virus in a heavy enough inoculum to actually infect you diminishes when you're in very transient contact with the infected individual. So if a student happened to be infected unbeknownst to anybody, then that transient exposure would help protect the teacher. Similarly, if the teacher were infected unbeknownst to the teacher, you know, because asymptomatic disease is probably 35 to 45% of all the cases, then they would be minimum risk to their students with that kind of approach. It's not the same as sitting next to the pupil on the same piano bench for an hour and sitting and working with them. What we're doing is we're trying to pivot that classic approach to something that is satisfactory but perhaps not ideal, at least for the next year until we have better treatments and new vaccines. These classic public health approaches are all we've got.
Yeah, thank you so much. Todd Birdsong from the Clemens Fine Arts Center has a question for us.
So the New York Times has rated going to an indoor theater as one of the riskiest behaviors. So how do we overcome that, this rating and this stigma? Because I would suspect that that's going to keep a lot of people away.
Well, now I have my personal view, and that is that we in the arts community, I'm adding myself just for fun. So we in the arts community need to rebuild consumer confidence. And there are a number of strategies that I think one could consider. First of all is appropriate written communications on your website, handouts at the performances about precisely what you've done to make your theater or your arts venue safer. And I think people will appreciate knowing the efforts being made on their behalf. That's a way that you can increase confidence. Another is that the greeter in the museum who, you know, is at the front door, or the director of the arts venue, or perhaps a respected local physician or nurse or public health professional or political leader would actually make a statement from the stage, or to the group that's assembling for the smaller group that's assembling for the tour of the museum, and actually take 2 or 3 minutes before festivities begin to explain what's been done to keep people safe and to ask for their cooperation, for example, mask use. And that would be another thing that I would feel, if I were in the audience, good about. I wouldn't feel put upon. I would say, oh, what a nice courtesy that director so-and-so or doctor so-and-so or public health professional so-and-so has taken the trouble to explain to me what's being done. A third strategy might be just some very simple strategies around not having crowding in any kind of way, shape, or form. Because if the lobby is crowded, the bathrooms are crowded, the concession stand is crowded, the box office is crowded, you're going to have a lot of people coming once and not coming back. And word of mouth is so vital. So if a 68-year-old longtime supporter of your ballet company or your symphony orchestra or your museum comes home and promptly tells her or his friendship group about how comfortable they felt at the event or at the museum, then word gets around and you start building consumer confidence. I also think you can start working with some of your bigger audiences in your community. For example, if you're in Louisville, would there be any harm in trying to recruit Humana or Brown-Forman or any of the other major industries in town, and seeing if they would sponsor some of this arts and safety material? Ultimately, they may very well take an interest, and they may advertise some of your arts events with some of these safety measures to their own employees. Try to rebuild through the private and public sectors. I mean, I can go on and on. There are a lot of other ideas out there, and I think if you put your heads together in Kentucky, you can probably come up with strategies better than what I've suggested on how to rebuild consumer confidence. Because, you know, we can open up and nobody comes. That doesn't do us any good. That doesn't do our customers and our supporters any good. So we do have to rebuild consumer confidence with strategic approaches along these lines.
Right.
We have a question in the chat that's along, well, in the past, we promoted our community and the Arts Center during trade shows. In preparation for those types of events, is it best to enclose the booth with a shield, or the face mask and distancing just as effective?
That's a great question. Krystal may also want to comment, but my thinking is that when I go to my local pizzeria, which I did last week, to get a takeout pizza, and they had put a thin plexiglass that they hung from the ceiling. It wasn't a big, fat, thick thing. You don't need that. You know, a clear shower curtain would probably do the trick. But the point is, they had put that, and they left a little gap at the bottom where they could shove the pizza through, and I could shove my money through. And I liked that. As a consumer, I felt like this is a pizzeria making a little bit of an effort to keep their employees safe and to keep me as their customer safe. So I think maybe it's psychological, but I see no harm in additional barriers. So you've got the mask, you've got the distancing, you've got an additional barrier. Now, if the logistics of the trade show are not friendly to a barrier, I'm thinking of some of these farmers markets. You know, if they're outdoors, now that's not an art venue, but if it's out, or let's say an outdoor crafts fair, you know, there's nothing about the tents or venues that makes it friendly to drop something. And in that case, I might just arrange the items so that I could stay physically distanced. And the advantage is hopefully you're outdoors. So it's a judgment call, but I just want to share that sort of pizzeria story with you. Krystal?
A great point. So the only thing that I would add is thinking about the type of space, especially move into the winter months. Many of these shows might be indoors, and thinking about the ventilation, the filtration that's possible. And in many cases, you're traveling to these spaces, you don't know what the infrastructure is going to be like, don't have any control over it. So bringing a small portable air purifier with you to place within your booth, that might be another option, and that doesn't have to be heavy or just requires a single plug that you can place nearby.
Well, thank you both. Emily, we're so thrilled to have joined you here today in Kentucky. Thank you so much for having us. We know we just barely scratched the surface and kind of, you know, dipped our toe in the water here a little bit, but Sten and Krystal, you guys are so special to us. Thank you for taking the time out today to share with another part of our wonderful country here. Folks, we just want to help you in any way we can. So please use the resources that you can find on the Yale School of Public Health website, on the Shoreline Arts Alliance website. And I'm sure Emily and I will be in touch. So if there's anything that you need, don't hesitate to ask Emily, and she can pass the information along to me, and we can find the right sorts of help. The next webinar that Shoreline Arts Alliance is hosting for the nation is about consumer confidence. We're actually collecting data right now as we speak. We don't know what we're going to say in 10 days here, but we're collecting data right now to determine what's happening out in the community and what are people thinking, so that we can advise even better how to move forward. So again, it's about long-term viability and the future of the arts and culture sector. Again, I'll turn it over to Emily here, but on behalf of the Shoreline Arts Alliance and Yale School of Public Health, thanks for having us today, and we're here to help whenever we can. So thank you, Emily.
Thank you so much for sharing this wonderful information with Kentucky arts organizations and sharing the work that you all have done in Connecticut for your organizations, and work that is benefiting the nation, obviously, as we all continue to work through these conditions that we've never faced in our lifetime. We just appreciate your time so much and your expertise. I also want to thank Todd Burnsong, Joy Brown, Mitzi Sennett, Steve Hoffman, and Kim Baker. And thank you to our captioner, Laura Kogut, also for captioning today's event. This webinar was recorded, and it will be put on our YouTube channel in the next couple of days, and will also be sent to all of the attendees to keep for your reference. So once again, thank you so much, Eric, Sten, Krystal. We love you in Kentucky. One of the most unfortunate things about meeting this way is that you don't get a big round of applause at the end, that you hear how wonderful we all thought you were. So thank you so much for all of your help. And thanks to everybody who attended today. We will see you.
Thank you too. Take care. Okay, bye-bye.
Bye-bye.